Introduction. I'm Dr. Loon, and my specialty is general surgery. I work in London at Barking, Havering, and Redbridge University Hospitals NHS Trust. My research is a systematic review. It's a level one evidence in hierarchy of the research, and it's basically title is comparative effectiveness of surgical drainage techniques and post-operative interventions for reducing complications, systematic review of randomized controlled trials. So, as far as surgery benefits our patients, and it is the best sort of treatment that one can have to remove the main cause at first place. It does have some complications associated with it. Like considering the background, so post-operative complications continue to be a major concern across the surgical disciplines. One of them is like seroma, which is the accumulation of fluid in the surgical area. So after the surgery, there's a wound that forms, and we stitch it, but there is a reaction of the tissue after the surgery that leads to this exudation of fluid, and then this fluid accumulates and increases the pressure inside the wound. So this actually leads to a complication that leads to the delayed wound healing after the surgery. Another one is like hematoma, so localized bleeding under the skin, infection due to the poor drainage, and these complications actually lead to this delayed wound healing and then patient discomfort and a longer hospital stay, which something we need to consider in this research. So that's why we delved into this. To address this, surgical drainage techniques are commonly used. So for the layman, it's very easy to understand that it's a tube-like structure that we place inside the wound when we close it after the surgery, so that anything inside, like a fluid or if there's any bleed inside, it comes out from that tube, so that the tissue inside can heal effectively. And I think it becomes then clear that why we use this. But the problem is there is no consensus on which method is most effective. We have a wide like array of options, like conventional drains, as I described, some more advanced like pigtail catheters, vacuum sealing drainage, and use of hemostatic agents to control this bleed. So this inconsistency in practice and lack of comparative evidence actually led us to conduct this systematic review. So uh, the objective of this review, so the aim of this review was very straightforward: to evaluate and compare the effectiveness of different surgical techniques and post-operative interventions in minimizing the complications after the surgery. We specifically focused on vacuum sealing drainage, so that there's a vacuum creation in the wound area, and there's a negative pressure, so that there's a suction, and then this helps after the surgery. Pigtail catheters and traditional drains, along with some adjunctive interventions like hemostatic agents and variable vacuum pressures. Our goal. Our goal was to determine which of these methods truly improve clinical outcomes, like reducing these complications, as I mentioned, seroma and hematoma and post-operative pain, so that we can have reduced number of complications after surgery and reduced hospital stay for our patients. In terms of methodology, we followed the Prisma 2020 guidelines. So Prisma is basically the preferred reporting items for surgical, for systematic reviews and meta-analysis. And we searched all the five major databases online available, like PubMed, Medline, Embus, Cochrane Library, and Sinal. We evaluated data ranging from 2019 January to September 2024, and included all the GRE literature, clinical trial registries, and conference proceeding to basically minimize the publication bias. And we used specific mesh terms and keywords like surgical drainage, post-op complications, hemostatic agents, and also pigtail catheter, specifically using the Boolean operators for accuracy. The Prisma flowchart is here, and this clearly illustrates how narrow our study has gone. From 105 records were identified, and this Prisma has really helped us to identify the focused 10 randomized control trials, and that actually met our inclusion criteria. Considering eligibility criteria, so to actually maintain methodological consistency and ensuring high quality evidence, we only included randomized controlled trials that were published in English from the same period that I mentioned, from January to September 2019 to 2024. And studies had to involve adult human surgical patients that aged 18 and over, undergoing procedures where drainage techniques were post-operative interventions are applied. So it's very common that you guys should have seen, um, uh, specifically in our tummy, in our abdomen, these drains are very common. There's some like pipe-like structures come out. So this is something that we thought of as the patients undergoing these procedures should be included, where these drainage techniques and post-operative interventions were applied. We focused on trials that specifically measured outcomes like seroma and hematoma and infection rate and hospital stays. We excluded all the animal studies, pediatric patients, non-surgical drainage methods, and of course non-peer-reviewed articles. And this helped us to actually focus on the studies with direct clinical applicability. In terms of data extraction and synthesis, so we it was carried out by using our standardized Excel form. Two reviewers independently screened titles, abstracts, and full text, and it was then reviewed by the third one for any sort of disagreement between the first two primary reviewers, and then consulted to ensure the objective inclusion. So for each study, because it's a systematic review of all the published evidence. So we recorded all the key details like authors, year of publication, key type of intervention, surgical context, outcomes measured, and any reported limitations. So, and given the heterogeneity of the studies across the procedures, we opted for a narrative synthesis approach because it was difficult to then conduct the meta-analysis, and this allowed our group to find things in a thematical fashion like drainage efficiency, complication rates, and recovery time. Um, in terms of key results, we here we present clearly a summary of the findings from these 10 included studies, comparing. So pigtail catheters, like in thoracic surgery, they consistently led to the reduced postoperative pain and pleural effusion and shorter hospital stage. This thoracic surgery is usually in the chest area, and vacuum sealing drainage was effective in orthopedic surgeries involving joints and bones, and facial surgeries, improving the drainage volume, and wound healing and pain scores for the patient's benefit. On the other hand, hemostatic agents like Like polysaccharide-based materials and gelatin thrombin matrix sealants did not consistently reduce complications like stromatoma or hematoma, and and increasingly some studies even found even non-drainage approaches can be of great benefit in some surgeries like knee arthroplasty, and this leads to faster functional recovery and less pain. So these techniques clearly stand out, and others appear to be procedure specific or even ineffective in some contexts. Um, in terms of discussion and interpretation, so overall, we found that minimally invasive techniques like pigtail catheters and vacuum sealing drainage were consistently associated with better clinical outcomes. The ability to reduce discomfort and promote faster recovery, this likely stems from efficient fluid evacuation with minimal tissue irritation. So the idea is very simple. So whenever there's a surgery done for a patient, of course there is going to be a wound, and then anything underneath the tissue, either it is fluid or blood, it should be evacuated so that the tissue gets to its normal healing ability as soon as possible. However, these hemostatic agents, specifically, we noticed that they were not, they showed limited or inconsistent effectiveness, leading to and due to various factors like tissue response, surgical complexity, and underlying comorbidities like patient has diabetes or other conditions. So these things also impact. These findings emphasize that not all interventions work equally well. So the three things that we have to look for is surgical context, patient characteristics, and evidence. So all of these, when we put three things together, and then we can inform our clinical practice in terms of going forwards. Uh, Implications, considering it is level one evidence that directly informs the clinical guidelines, and can help change practice in terms of going forwards. For surgeons, these results suggest that pigtail catheters in thoracic procedures and vacuum sealing drainage in orthopedic settings can meaningfully reduce these complications and speed up recovery. Surgical nurses can play a very crucial role to actually monitor the drain output, early removal, and educate patients, and after the surgery, even some district nurses, how they help can be of key factor. And our findings clearly challenge the role of hemostatic agents, and clearly uh, is a step and direction towards personalized care for each patient, and plan accordingly with multidisciplinary teams what we are going to need in this type of surgery in this specific patient. Finally, to summarize, I would just say, so pigtail catheters and VSTs are clearly the effective and safe options. Hemostatic agents are inconsistent, have showed inconsistent benefits, and going forwards, we need more large-scale randomized control trials across diverse patient populations, because considering the heterogeneities across different countries, different populations, different resources, we also need to standardize clinical guidelines for drainage selection and postoperative intervention. And this review clearly offers a clear evidence-based framework that clinicians can apply to optimize outcomes, reduce complications, and improve resource and surgical care. Uh, so that's it. Thank you so much for your attention, and I'm happy to take any questions. Thank you so much.